This Keloland Living segment is sponsored by Lewis Drug.
As we look ahead to 2026, Medicare Part D is undergoing some of the most significant changes in its history. Changes that are designed to make prescription drug coverage more affordable and predictable for people enrolled in Medicare.
Today, we're going to walk through those updates that you need to be aware of if you're currently considering your 2026 Medicare options.
Nick Elgersma is a pharmacist with Lewis Drug, and he's here to tell us more about what's changing.
He says it's also important to understand why these reforms matter and what steps you should take to prepare during the current open enrollment period, which ends in just 2 weeks. Welcome.
Thanks for being here.
Thank you for having me.
So what do we need to know?
Yeah, so a few changes going into 2026 from 2025. Important thing I like to lay out for people, first of all, is just make sure you look at your options that are out there. There's a few different options within Medicare. So you can have your standard Medicare coverage and add on a supplement plus a Part D coverage, or you can have a Medicare Advantage plan, which would replace some of those. That original Medicare might have a prescription drug coverage within it, but also might have some other benefits. So important for people to just look at what options are out there for them and what might be cheapest or fit them the best.
So Part D is for drugs?
Part D is your drug coverage.
Yeah.
Correct.
Yeah.
That's correct.
So for people who take several daily drugs or medications, is this change going to help lower some of their monthly pharmacy bills?
As with anything, everything always seems to be going up in price. So for 2026, the deductible is increasing from $590 for the year to $615 for the year. Along with that, this past year they had a $2,000 out-of-pocket cap that you would pay for your copays. That's increasing to $2,100 now this year.
Okay.
They're also continuing this year, and this was new in 2025, is the Medicare Prescription Payment Plan. And what that does is it essentially spreads out the cost of the medications. So instead of paying maybe a high cost of the medications or your deductible, everything at the beginning of the year, it spreads that out throughout the year. But important within that to know if you have consistent copays then throughout the year, because it can sometimes stack up based on how it calculates out.
Right.
So just important to look into that as well before signing up.
And should you know, is this the part where if I come into my pharmacy and I say, yeah, I need help because I don't know, and you know all the drugs I'm taking because it's my pharmacy, right?
Right.
So we can kind of figure out what I need.
Yep. So at Lewis, we're able to run a comparison of the different plan options that are out there. And give that to you just to see, okay, this is what my cost would be for the entire year if I look at my premium plus my co-pays, if what medications are covered, if I need to switch plan because a medication I'm on might not be covered. So I can look at that and what options might be out there.
Yeah.
What's the most common mistake people make when it comes to this change?
Most common mistake, I'd say, is just not looking, is just staying consistent and assuming everything stays the same. So it's easy for maybe a copay to increase or a medication not be covered, and then come the first of the year, you don't know why you have to pay so much more out of a pocket versus what you did last year. So it's just important to take a look. So the biggest mistake is just not looking.
But if they're already enrolled in Part D, in the Part D plan, do they need to actually take action for this 2026 one, or will the changes automatically happen?
So if you have a plan currently that is continuing into 2026, you don't have to do anything. You would automatically re-enroll into that plan.
Okay.
However, if your plan is ending and it's not continuing to another plan, then you'd have to actively look for a new insurance plan to sign up for.
And that's where people might be missing completely.
Exactly.
That they just don't know that their
they
specific
might not.
one
They
is
might have
ending.
missed a mail out. They might have missed some communication that might be out there. So it's just important to always take a look and see what other options are out there, and to know if your coverage is continuing into that next year. So.
Well, I think that's probably something people are really missing, though, is the opportunity just to go into the pharmacy. If you're going to even print out comparisons for me, and you already know all the drugs I'm taking, that's like the easiest thing to do.
Exactly. Yep. And it's also a thing where pharmacists, we're in the front line. We're the most available healthcare workers that are out there. You can come talk to us. There might be another medication that works the same way as one of the other medications that you're on that we could switch to. Works the same way, might work just as well for you, but you might save hundreds of dollars potentially throughout the year just by switching. So
yeah, are there any brand new medications that will become more affordable under this?
Yeah, so Other new thing within this year is the Medicare fair price negotiation. So the government has negotiated with some drug manufacturers to help lower the cost of some medications. So one big one that is pretty common is Eliquis, which is a blood thinner. And that one, the government negotiated the price with the manufacturer, so it lowered the price of the medication, so you might not have as high of a copay at the pharmacy. You still might pay the same throughout the year, so it might take a little bit longer for you to reach that deductible, but it won't be as big of a hit necessarily at one time.
And you can also add more supplemental help if you...
Yep, so those you'll be looking at like an Advantage plan, for example. They have other benefits that can be included in there, including hearing, dental, vision can all be included. There might be other benefits that might be included depending on the plan. So Medicare Advantage plans have that aspect to them for some additional coverage. Otherwise, if you're in traditional Medicare, so Medicare A plus B, you can add on a supplement plan, which could also help with your Medicare A, B copays, might help with a deductible, whatever it might be, going to the hospital, doctor visits.
Wow,
one of the biggest one of the biggest worries for retirees is for unpredictable medication costs. Will 2026 make some of those costs more stable?
Potentially. And that's where it helps having one of these plan comparisons and being able to look at that, because when we run that plan comparison, it will tell you your costs, your expected costs per month. You can plan that out. You have an expectation of, okay, you can budget. You can say, okay, January I have to pay this much, February will be this, March, et cetera. And that payment plan can come in handy then too if you have a high cost at the beginning of the year and you can spread that out. So big aspect, you aren't necessarily always saving money, but it can help spread out the costs. It can help make it easier for you to afford throughout the year versus having to really tighten up at the beginning of the year or later in the year, whatever it might be.
Do you find that there are people not taking full advantage of their insurance as well ever? That like there's things covered they just don't even know they can get?
Potentially, especially with the Medicare Advantage plans, because there can be over-the-counter benefits. They might have similar to like a health savings account where they might have a specific amount that you can pay for over-the-counter medications that can help cover those costs, or there might be a food benefit included in there as well where it will help pay for maybe some groceries for a month or a little stipend there. So definitely take a look, especially on those Advantage plans, what options are all included in there.
Yeah, but it sounds like make sure that you go to your pharmacy.
Definitely ask us.
Like always, that's the main thing.
Exactly.
Thank you so much for being here.
No, thank you for having me.
With 61 locations across the upper Midwest, Lewis has been a trusted neighborhood pharmacy and market leader for over 80 years.
Simply head to lewisdrug.com to find the location nearest you. And while you're there, to be sure to download the Lewis app to your smartphone to get special savings and chances to win Lewis app rewards.
This Keloland Living segment has been sponsored by Lewis Drug.
We'll be right back after this.